Good morning. Welcome to Healthy at Home. Today we are continuing our discussion about the hip. And more specifically, I'm going to get into the hip flexors. Last time we went over some stability exercises, which that video, the recording is posted on my YouTube. And today we're going to get into some more hip flexor stretches so that we can focus on mobility of the hip. So I'm going to do a screen share so you can see the PowerPoint. Give me just a moment to share my screen. Okay. Voila. Here we are. You know me, I'm Dr. Melanie Carminati. As a disclaimer, this is just educational. This does not replace or exchange skilled physical therapy. If you are in need of skilled PT, we're doing all virtual services at NCPT, so you can shoot us an email or give a call. So we spoke about, first of all, I love Netter's Anatomy Atlas. That's my go-to. So this is where all of these photos are going to be coming from. Last session on Monday, we spoke about the hip joint. We got into a very basic anatomy of just understanding, how complex the hip is in and of itself. We have the lumbar spine, the lumbosacral plexus. Those nerves are traveling down in that area, and there's a lot of organs, muscles that fill in this space. So there's a lot, but we're just looking at it now to appreciate the bony anatomy, to look at the nerves, and just to see how intimately related the hip joint is with the pelvis and then the lumbar spine. So next, we pointed out last time too the differences in the sizes of the pelvis. The female pelvis is wider to accommodate for childbirth, and then the male pelvis is much more narrow. In the close-up here, we had an opportunity just to see some of the abdominal muscles that we've spoken about in the past and how they, oh, hold on. How do I go back? There we go. And how they traverse through this area, some of the vascular supply. This is a male pelvis. We can see because the spermatic cord is right here. So if this was a female, that would not be there. And last time we spoke about the hip joint, specifically how the femoral head acts as that ball. The pelvis itself creates the acetabulum, which looks like a little ice cream scooper, and the femoral head goes in there to create the ball and socket joint. So I'm not going to spend as much time on this slide as we did last time. I want to move along to the hip flexors. So there's two hip flexors that only involve the hip joint. The other hip flexors involve the hip joint and the knee joint. So what we're looking at here first are the iliacus and the psoas, which merge together to form the iliopsoas. The iliacus is on the ilium, right? So that's the pelvic bone, and it merges here with the psoas. The psoas originates on the anterior portion of the lumbar spine. So many times people think that the hip flexors are just at the hip joint itself, but in actuality, the muscle, the psoas muscle, originates on the lumbar spine. Hence why as a physical therapist, when we're treating a hip condition or a hip pain, or hip symptom complaint from a patient, we also need to take into consideration the lumbar spine, not just because of the bony anatomy, but also because of the muscular anatomy, the myofascial connections, all of that jazz. So you can really see here, lumbar spine, muscle originates, comes down, inserts here on the trochanter. Next, this is from Netter. You can appreciate the other hip flexor muscles that involve both the hip joint and the knee joint. So you can see here, this is the sartorius muscle. Fun fact, it is the longest muscle in the body. It has a diagonal course. And The sartorius, as you can see, it inserts or originates, should I say, up here and then travels down, inserts at an area called the pes anserine. You can see they pointed that out there. There are other muscles. We have the rectus femoris. This is one of the big guys involved, also originates up here and involves the knee joint. So I'm just giving you an appreciation of the differences in the hip flexors themselves, how there are some hip flexors that originate on the lumbar spine and then insert onto the hip itself to create hip flexion, which is the motion of the thigh coming up. I'll demonstrate that in a minute. And also that there are hip flexors that originate at the hip joint and then travel down the thigh involving the knee. So diagnoses, we spoke about osteoarthritis, leg calf perthes, femoral acetabular impingement. These are just some diagnoses. There's also muscular diagnoses involving the hip, such as hip flexor tendinitis, hip flexor tendinosis, hip bursitis. So there's many diagnoses, but these are just some. Physical therapy treatment. So how do we treat it? First of all, when people have hip pain, it tends to be rather uncomfortable because in order to walk around and ambulate in the world, you need to be using your hip joints. So pain management is important first. Therapeutic exercise-wise, we need to stretch, which we're going to get into today. Strengthen, which we did last time. Core strengthening, we've done lectures before. We spoke about that. Posterior chain strengthening, we've also done that. And then neuromuscular education. So learning how to properly stand, walk, squat, and then sport-specific retraining is important when you're treating the hip. So I'm gonna stop my screen share and we're gonna get into some hip flexor stretches. So let me just re-angle. Okay, that should be good. Now I have ear pods on, so if at any point you feel like you can't hear me, let me know. So I'm going to demonstrate 3 different hip flexor stretches. The first one I'm going to demonstrate, I like to use a towel. If you have a pillow, you can also use the pillow. This is just going to be for the knee that's down because we're going to be in a half kneeling position. So towel, down. You're going to also want to be near something that's sturdy and doesn't move. So for me, I'm using my couch. The first thing you want to do is use your fingertips to find your ASIS, or what they are. That's the anatomical bony landmark, but they are the pelvic bones that point straight forward, or they should be pointing straight forward. Now, when you come down onto one knee with the other knee up, commonly they'll end up pointing slightly downwards. But what you want to do is try your best to think of those pelvic bones like headlights of a car. So you want them to be pointing straight forward. Okay? So in order to do that, that's going to require you to engage in your pelvic floor, engage in your deep transverse abdominis, and then slightly engage in your glutes too to keep the pubic bone pressed forward. From here, just inchworm the front foot forward slightly. The right hand, if your right thigh is up, is going to go on that sturdy surface. You're going to slightly lunge forward. Now, if even before you lunge, you feel a stretch and that's intense, you'll stay with that. If you want a little bit more, you slightly lunge forward. And then to increase it, I recommend bending up and over to the right. You hold these stretches for 30 seconds. I love this one because this one really gets to the psoas, which is that one that originates on the lumbar spine. Come back up. And then you do it again. So whenever you're doing these stretches, again, you're holding it for 30 seconds. I also want to point out that you never want to let the ribs arch or pop forward like that. You're trying to keep the spine and the ribs stacked over the pelvis as much as you can as you're doing the side bend. So you come back up. Can you hear me okay? Yeah, okay. And then you always want to do it on the other side. So normally recommendation is that you do 2 to 3 repetitions of that on each side. So opposite knee down, other foot up. First thing, we're going to find those pelvic bones, fingertips on. Think of them like headlights of a car. You want them pointing straight forward. Wiggle or inchworm that other foot forward. Where's your rib cage? Spine should be nice and straight. And then you just slightly lunge forward into that front leg. From here, we can add in that side bend, watching that the ribs don't pop forward and you don't arch your back. And you're holding for 30 seconds. You come back up, you shift back. Obviously, I'm doing this a little bit faster for demonstration purposes. And then you come back up. Now, these are general recommendations. So if you have had a knee replacement, you don't really want to do that one because it's a lot of pressure on the knee. If you've had any recent knee surgeries, you also don't want to be kneeling on the knee. So we're going to go into another variation. The other variation that I like is the standing hip flexor stretch. This one gets more into the muscles that also involve the knee joint. So I may just angle this up. Okay, so I also recommend having something to hold on to. You'll grab either the top part of your foot or the ankle, whatever is accessible for you. Now, from here, I'm just gonna come where there's white behind me since I'm wearing black. You can see the tendency is to let the knee go forward. You want the knees, ideally, to be lined up with one another. Then you're gonna think about those pelvic bones, the headlights of the car, pointing straight forward. This is gonna require you to engage in your pelvic floor, your deep transverse abdominis, and you're also holding this for 30 seconds. Now, just corrections for this. Again, you don't want the knee to go forward, but you also don't want to be pulling the knee back and tipping your whole body forward like a seesaw. So the torso should stay erect, hip bones pointing forward, and you're holding it for 30 seconds. Take a break. I always recommend alternating sides as you go. So you're going to be having your hand on something sturdy, grab the ball of the foot or the ankle, knees are lined up. You don't want the knee forward, you don't want the knee back, and you're just holding here, lengthening. So like I said, this one gets more of the hip flexor muscles that involve both the hip and the knee. So you'll feel this for sure in the knee itself. Breathing into it, exhaling. Again, inhaling and exhaling. Okay, now the last one is an advanced one. So this is not something you would do as the first hip flexor go-to stretch. So once you've progressed and say you're a physical therapy patient and you know, you've developed more flexibility, the next progressed version is it's a variation of a yoga move, which I'm not a yogi, I'm a Pilates instructor in addition to being a PT. So I don't know the term, but your hands are going to come on either side of the foot. And I always recommend that your torso rest on the thigh of the leg in front. You want to keep your spine straight and you want to feel the length from the crown of the head traveling down through your spine, out through your tailbone. So we're here, breathing into it, lengthening through here. So the core is still engaged. We're not slumping into the stretch, right? And this is a very intense stretch. Now for me, I could possibly use some yoga blocks on either side of my foot just so I don't have to reach as far with my hands. Everyone's arm lengths are different, and depending on how flexible you are, you may need some support and props with that. So once you've held that for 20, 30 seconds, I say 20, even though 30 is the goal because sometimes reaching 30 takes a journey to get there. So you'll shift back, you'll take a nice counter stretch, and I recommend flexing and pointing the foot about 10 times. Again, we're trying to keep the spine nice and straight. We're not rounding as we're doing this. And if you want to stretch a little bit longer before you go back into it, you can flex the foot towards you. Okay, so you would go back into it. You do that. Same thing, hands on either side of the foot. My chest and torso is on the thigh. Breathing into it, feeling the energy out the back heel and out the top of the head. And then I would do the counter stretch back out. So to do the other side, just so we stay even, other foot, hand on either side, extend the leg back, torso is on the thigh of the leg that's lifted. Feel that heel reaching back, energy out the crown of the head. So for me, I feel like this side's more flexible. So my left side that I was stretching before feels tighter. You'll lower down, you'll shift back. You'll do the ankle pump 10 times. If you want to then do a little hamstring stretch to hold, you can go for it, but then you'll repeat it again, 2 to 3 times. Everything, the goal is to get to 30 seconds. If 30 seconds is too much on the first round, do 15 seconds or 20 seconds. Okay, so those are my 3 hip flexor recommendations. Now, I am going to take any questions now. Tracy, do you have any questions about that? No, you don't? Okay, so I'm going to go back to the screen share because there's just a few announcements that I have. Let's see. Okay, announcements. So Healthy at Home. This is a free 30-minute video chat. I speak about different topics. Next week, we're getting into the pelvis. So I'll be discussing different pelvic conditions and specifically pelvic floor conditions as well, since I also treat pelvic floor. Then that actually Healthy at Home, the last session is going to be May 29th. So we have 2 more full weeks of it, Monday and Friday. We'll speak about the pelvis next week on Monday and Friday. And then on the last week, we'll speak about the foot and ankle. So we've covered pretty much most of the body in all these Healthy at Home chats. Then we are still doing the virtual Pilates beginner mat class, Tuesdays at 11. I'm teaching that. There's 1 spot left in that. The intermediate class, Wednesdays at 6 p.m. Dr. Amarantha Burkle's teaching that. We have some more spots. That is a more challenging class. And there's a new promotion. If you refer a friend to the class, to a virtual Pilates class, you get 1 class free. And then Dr. Martinez and I are still seeing patients virtually and Pilates one-on-ones. So this webinar is about scoliosis and disc herniations. That is available. If you're interested, shoot us an email there. And then I'm really happy to announce this Instagram and YouTube live series that I'm starting on May 26th. So this is why we're transitioning out of the Healthy at Home, although I will still be posting videos on the YouTube channel called Healthy at Home, but it won't be live. So this will be the live version where I'll be bringing on different guests to speak on different topics. May 26th, the lovely Blossom Leilani Crawford will be speaking about the evolution of Pilates. Dr. Saw Bronner, who is the physical therapy director for Alvin Ailey Dance, will be speaking on May 27th. Dr. Allison Shirkonde will be speaking about pelvic pain. She's a pelvic rehab doctor from Manhattan on June 2nd. June 3rd, we'll have Catherine Fugelsang. She's an acupuncturist at Element Healing in Brooklyn. June 9th, Tracy Matthews will speak about fascia. Fascia is a connective tissue that runs from head to toe, and it has a big influence on how we move and our health and function. June 10th, Dr. Ben Taylor is going to speak about osteopathic tips on how to stay healthy at home. And then June 17th, Kit Behun is going to chat with me about innovation and the transformative power of Pilates. So follow us on Instagram to catch that live at 5:30. These are all Tuesday and Wednesday dates, so 5:30 those Tuesdays and Wednesdays. Here's my contact info, and thank you. Let me stop
Thank
this
you. That was
recording.
great.